Hi, I'm Ellen and welcome to Mentally Detoured. My usual disclaimer, I am not a mental health professional. Back to our discussion on depression. In part 1, we learned that depression is a serious mental health condition, what the symptoms of depression are, and that it is treatable. Part 2 will cover the causes of depression and briefly cover the treatments. I say briefly because each of these treatments will be covered in greater detail on their own. Unlike physical illness, where you can see the ugly little virus with a microscope, and maybe there's even a vaccine to prevent it, with mental disorders, depression included, it is not so easy to pinpoint a cause. But illness it is, and there is a biological component. First of all, genetics. According to a paper published by the Department of Psychiatry and Behavioral Sciences at the Stanford School of Medicine, scientists have looked at familial patterns to determine the heritability of depression. Heritability is roughly the percentage of the cause of an illness that is due to genes. In the case of major depression, heritability is 40 to 50% and may even be higher in the severe cases. What this means is that it is approximately 50-50 that depression has a cause that is genetic or non-genetic. Other biological causes include an imbalance of certain chemicals called neurotransmitters that naturally occur in the brain. An imbalance of hormones may also trigger depression. Thyroid problems, menopause, and other conditions can affect hormones. Some medications may list depression as a side effect, and there are other conditions that increase your risk of depression, such as heart disease, cancer, or diabetes, among others. And then there are the life events that can trigger depression. Traumatic events such as the death of a loved one, financial problems, high stress, or childhood trauma are just a few of the life events that may be risk factors. Other factors that may cause or trigger depression include having depression as a child or a teen, a history of anxiety disorder, borderline personality disorder, or PTSD, abuse of alcohol or other illegal drugs, and certain personality traits such as having low self-esteem and being overly dependent, self-critical, or pessimistic. Knowing the multiple risk factors and potential causes for depression can be helpful, especially if you fall into a group with higher risk or have depression run in your family. Depression is treatable though, and there are several different treatments. Each of these deserves a video of its own, so I'm just going to give you a quick run through here. Medications. The pharmaceuticals. Antidepressants are the second most prescribed drug in the United States. According to a CBS News report in 2013, nearly 1 in 4 women ages 50 to 64 were found to be on an antidepressant, with 13% of the overall population also on antidepressants. So yes, antidepressants are one of the treatments, and chances are you've heard of them. They are not one size fits all, however, and sometimes several have to be tried to find one that works. The downside to that is that they often take several weeks to fully take effect. Often, the first prescribed are the selective serotonin reuptake inhibitors, better known as SSRIs. These medications are safer and generally cause fewer bothersome side effects than do other types of antidepressants. Some commonly known SSRIs include Prozac, Paxil, Zoloft, Celexa, and Lexapro. Newer and atypical antidepressants include the serotonin and norepinephrine reuptake inhibitors, or SNRIs, such as Cymbalta, Effexor XR, and Prestige. The norepinephrine and dopamine reuptake inhibitors, NDRIs, one of which is the well-advertised and well-known Wellbutrin. There are even more antidepressants that don't fit neatly into a category. Older types of antidepressants have more severe side effects, and they are typically only prescribed when all other medications have failed to work. These are the tricyclic antidepressants and the monoamine oxidase inhibitors, or MAOIs. In order for treatment to be most effective, it is often recommended that in addition to medications, a psychotherapy treatment take place at the same time. There are different types of talk therapy, including cognitive behavioral therapy, or CBT, learning to use mindfulness techniques, or a traditional type of talk therapy. Forget about Freud's couch. I've been in therapy and never once had to lay down on a couch. For the treatment-resistant depression, electroconvulsive therapy, ECT, is still in use, but has changed considerably since the one flew over the cuckoo's nest era. There's also a treatment called TMS, or transcranial magnetic stimulation, which I'll go into greater detail in a future video. If you suffer from depression, you may also find that some lifestyle changes can help reduce symptoms, and once an episode has passed, can help you maintain a healthy mood. Getting plenty of sleep and exercise, avoiding alcohol and other illegal substances, and learning your warning or trigger signs are just a few of these. Finally, alternative medicine. Some people do use herbal remedies and supplements, and mind-body connection type activities such as yoga, meditation, music or art therapy, and acupuncture can often be a useful addition to a traditional regimen. Depression can and should be treated. Left untreated, it can be devastating or even fatal. Please seek help if you have or you think you have depression. Until next time.